comorbidities and how we can diagnose and prevent. I'm not going to go into the details of pathogenesis, but just I'll be touching on some of the points. So comorbidities in menopause, we all know that abdominal obesity, hypertension, dyslipidemia, insulin resistance, this is at a very high prevalence in postmenopausal women, we all know, because of estrogen decline. And then it affects 1 to 2 times more women than men. So it is rising sharply from past 55 years, and it is seen mostly in Asian populations. Then menopause transition worsens these via visceral fat gain and glucose intolerance. So what are these comorbidities? So cardiovascular health, we all know, it is hypertension, atherosclerosis, coronary heart disease, and stroke risk in postmenopause. And metabolic disorders, central obesity, type 2 diabetes, insulin resistance, and dyslipidemia. Then bone health, osteoporosis, osteopenia, increased fracture risk, mental health, that includes depression, anxiety, sleep disturbances, and mood swings. Then most of the women, we all agree that they come to us with urogenital problems, initially with urinary incontinence or recurrent urinary tract infections, vaginal atrophy, and sexual dysfunctions. But at the same time, we have the cancer risks also, which includes breast cancer, endometrial, and ovarian cancers. Then other chronic conditions, we do come across arthritis and musculoskeletal pain. Then thyroid disorders are also booming up. So with all this, I think we have to concentrate on metabolic syndrome, and I think it is a silent storm. Now this metabolic syndrome is pathological and crossroads, where your poor lifestyle choices meet your genetic predisposition, and that leads to chronic diseases on the highway. And actually this I have picked up from one of our endocrinologists who gave us this talk of metabolic syndrome, which is a silent storm. I think it is really nice. And as I have told that, what are the predispositions for this metabolic syndrome is your genetic predisposition. Then added to that, generally people say that, in my family, everybody is obese and all that. But I think in addition to that, the stage is set with environmental triggers. What are those? One is lifestyle factors, and it's included sedentary behavior, high calorie Western diets, or not even Western, I think even Indian, some of the diets are so high calorie. And we all became dependent on the processed foods, and chronic stress, which also fuel the metabolic syndrome epidemic. Then urbanization has also its own impact. Rapid development, which reduces physical activity, because we never commute on our 2 feet, but then we want vehicular conveyance for everything. And then increased food availability. Now nobody need to cook, we have to just order. Then all these food, what is created is obesogenic, and environment which is there not only in our country but globally. Then family history, of course, ethnicity and demographic factors significantly affect both prevalence rates and clinical severity of metabolic syndrome presentations. No, so this is the latest report of ICMR India, and see, diabetes is 11.4%, and pre-diabetics is 15.3%. Then high blood pressure 35.5%, and general obesity 28.6%, and abdominal obesity 39%. Then high lipids 81%. This is the data which we have procured, and all these will increase the risk of heart diseases. So pathogenesis metabolic syndrome, the root causes, as we have said, that it's all about the obesity and adipose tissue dysfunction. Adipocytes expansion will cause hyperactivity, hypertrophy, and because of hypertrophy, the blood supply will reduce, because the blood supply is only for certain size, and if they outgrow, the blood supply will not be there and leads to atrophy, and this atrophy will cause other dysregulations. So this is all about the adiposity, which is the main cause for all other comorbidities. So that leads to chronic inflammation, the atrophic adiposity. Then inflammatory mediators are released, like cytokinase, then endothelial dysfunction will take place, that will affect the vascular lining, damage, impairs blood flow, then atherogenesis, plaque formation, then prothrombotic state, increased clotting tendencies. All these will lead to these metabolic syndrome, and that affects the heart, liver, and other systems. So this is a slide which says very nicely how this abdominal obesity has its effect. Then National Education Program Adult Treatment Panel 3. This is a very good tool for us to diagnose our women who come to us. Like, it's a very simple one. They have given these 5 criteria. Waist circumference, it should be not more than 80. Triglycerides, if they are more than 150. HDL, less than 50. Then blood pressure, 130 to 85, it is more. Fasting glucose, if it is more than 100. These are the criteria. Beyond, if they cross these levels, then we have to look at them as risk women for these comorbidities. And if we have 3 out of these 5, then you have to take action, and you have to counsel the woman for regulating. And they say that even if they have 3 criteria, if they are still having their criteria out of 5, if they have in 5 they have, still we have an opportunity to bring them to the normal status. So that is an advantage, and this should be taken by all of us. So screening and monitoring, so detailed history and physical examination, then bone mineral density, then DEXA 2 to 3 years if they are in the high risk, then annual BP, lipid, fasting glucose, then apolipoproteins and non-HDL, C, LDL, all these are cardiac oriented examinations. Then cancer screening also should not be missed. Then these are the imaging tests. And weight and hip measurement is very, very important. This should not be there. I think now we have weighing machines which we have all these factors where you can see the bone mass and muscle mass. Everything is there in that machine. If you make her stand on that, all the readings will come. You don't have to separately measure them. Then hidden dangers. The cardiovascular disease, we know that there are atherosclerotic and diabetes because of insulin resistance, then fatty liver disease because of which progress to liver damage, and sleep apnea, which we are seeing because of the weight and all these metabolic syndrome issues. Then management of metabolic syndrome, those strategies we should see that how to reduce the risk and improve the outcomes. So first line management, as we always see, is weight loss. So we never give them a difficult target. Only thing we can say is 3 to 5% of body weight reduce, and this will help dramatically. And now we have seen that diet management itself can reduce their weight. Then heart healthy nutrition, that's an important one. Regular physical activity. We all know that at least 150 minutes weekly, we have to do moderate exercises. Then stress and sleep, we insist that 7 to 9 hours of quality of sleep will reduce the stress and improves the emotional health outcomes. Then we have hypertension control, lipid management, glucose regulation, smoking cessation, and advanced weight management. So this is a very nice slide because here you can label the woman into which category she belongs to. So at risk, stage 1, at risk more than 1 criteria, then METs without end organ damage, and stage D is with end organ damage. Now if we have any women which is falling in stage B or C, we have an opportunity to bring back them to stage A. So this is the window of opportunity. We always look for it so that we can change the her health to non-metabolic syndrome diseases. And it is very simple: physical activity, nutrition, obesity prevention, then all measures in stage 1, medical therapy and risk factors modification. Then in stage C, all measures under stage B, adiposity reduction surgeries. And of course, stage D is not reversible and it has to be disease-specific therapies. So prevention strategies, lifestyle modification, which comes first in our list always, and in that, diet is the most important one, then exercise, then sleep and stress, and avoid risk factors like quit smoking, limit alcohol, maintain healthy weight. So IMS guidelines and recommendations. So we have to align with the Indian Menopause Society. So they have mentioned that screening at menopause transition is the most important one, and that is the point, window of opportunity to minimize, at least if they have already have, or prevent. Then promote nutrition and exercise. Then personalized start perimenopause assessment like CVD, obesity, diabetes, with the criteria what I have told. And public health, we have to educate our general practitioners on these issues, and at least they can refer the women to the specific menopause clinic clinicians for better treatment. Then IMS consensus statement, what they say is lifestyle modification, again, hormone therapy. Of course, it has to be individualized with risk after risk-benefit assessment. Then non-hormonal options and bone health screening for osteoporosis and supplementations, cardiovascular and metabolic health regular monitoring, and early intervention if diabetes or hypertension is seen. Then cancer screening, of course, for breast, cervical, and endometrial cancers, mental health, recognition and management of depression and anxiety and cognitive decline, because some of the women do come with these mental health issues. And I think this is all a repetition what I have already told. So nutrition, adequate calcium, then diet rich in fruits, vegetables, physical activity, and lifestyle habits also have to be taken care. So this is a nice one, lifestyle therapy. I think now where it is now lifestyle treatment and lifestyle therapy. So mental health, nutrition, physical activity, sleep, alcohol, smoking, all these are important and have to be taken care and intervened, and these are the factors which prevent. And I think this is one of the good slide, the 5 pillars of metabolic syndrome: abdominal obesity, high blood pressure, high blood sugar, high triglycerides, and low HDL. They are all largely built by the food we eat and the lives we don't live. We are supposed to live a healthy life, but we don't. Then all these are there. Medical interventions already we have told, so I won't go into the detail. And mental and cognitive health, counseling, and just now we have heard Dr. Neelam speaking about connections. So I think that support group and counseling helps a lot. Then early recognition of depression, anxiety, then activities to enhance memory and brain health. Then I think first of all, we all should take care of ourselves, I think. So your health is in your hands, and you should start today. A doctor who neglects their own diet and exercise will soon be writing prescription for themselves. I think we should not do that. So thank you so much. I think I have finished on time.